Welcome back to the Back Pain Solutions podcast. This is Jacob. Today I'm going to speak to you about a patient case, a situation of a lady that is middle-aged, has had um, specifically hamstring and glute, buttock pain for a long time. And I'm going to try and demonstrate the situation for something that it didn't turn out to be. In other words, she's been to many other therapists, specialists as well, to have a look at her, and nobody could really find out what it was. There was some idea and attempts to get her better. She has a therapeutic background as well. She's a physio, and so she had some idea of what's going on, and what it turned out to be was tested, but it wasn't tested well enough to actually establish what was going on. So let's dive into this case. Let's see what you can learn today. Maybe there's some associations between what you may experience in your own situation compared to this patient that I had. So, middle-aged lady who came into my practice not too long ago, presenting with buttock pain. And buttock pain, we typically look at buttock pain. Is it the upper part of the buttock, closer to the back? Is it more lower buttock, more the part of the buttock that you sit on, closer to where the hamstring starts? The area of where you feel it in the buttock really tells us a lot. So in her case, it was more the lower part of the buttock. So she would sit on a harder chair and she would have discomfort. So that she had to uh, move her weight off that side of her bum. In other words, she had to sit skewed to avoid it getting worse. Therefore, if you think of the what we call the ischial tuberosity, the sitting bone, that's also the attachment for the hamstring. You would imagine that it could have something to do with a muscle attachment and maybe too much pressure there. Maybe her pelvic structure caused her to have more pressure in that place if she'd have a hard chair that she was sitting on. But it didn't make sense in terms of the presentation. So when she would get it, what it would feel like, if she would not only sit for a long time, but she would work in the garden or have a long car journey, and then it would become a problem, so that she couldn't sit on a buttock. So the presentation really told me that there's more to the problem than just a localized muscle attachment or pressure on the bone or any soft tissue involvement. And so we went further, we tested. She turned out to be quite lean. So she is lean the best word. She was very flexible, so she did a lot of yoga in the past, and she had also the ability to be very flexible. She's a very flexible person. So when I did a test to see if there's a nerve tension involvement, it didn't resemble anything at first. And so I really had to help her to get into the right position. In other words, I had to really look up the stretch in this nerve. And she was very capable of doing it without going over her own limits. And indeed, we were able to reproduce that pain in her buttock with a certain position, trying to look up the nerve tension. And she said, yeah, that's it. So we reproduced it, we found it, and then we had to find out, okay, so how serious is it? Where exactly does it come from? And obviously in most cases, it comes from the low back. So we were able to find some instability in low back. We could correlate that to a nerve tension test that was very positive. Luckily, no power loss in the leg or in the foot. She's had this problem for a very long time. She's been able to function very well. The interesting thing is she was doing a lot of sports, and she was able to do them quite full on. She's also playing hockey, field hockey, so on grass. The only thing is that after a field hockey training or match, she would have a lot of discomfort. She'd have a reaction, and it'll last a day or two, and and it was really bogging her. So it was a real problem, and she wanted to find a solution. And so she went and looked a little bit further, and she ended up coming to me. So we kind of established that it wasn't a hamstring problem. It wasn't a muscle attachment problem at the sitting bone. That it had involvement of a nerve that runs through the buttock area, and it had to have an origin elsewhere than the buttock area. We then went on and did a few tests to see what her low back's like. We established some lumbar or low back instability, so we could reproduce issues or pain at the vertebrae in the low back. And I think those things are generally quite easy for me to find out and to stipulate to the patient and to point out. And sometimes the challenge is to be sure that there's nerve involvement instead of just soft tissue or muscular involvement. And here comes probably the most important part of the consultation, and that was actually what we did to make sure that we're going to get her better, right? So she's done many things in the past to try and get it better, but I got her to think about it, and she came to the realization, with my help, that when she would get a reaction every time that she would play either field hockey or do something different, she would ensure that the problem is actually being reproduced. And so she looked up that mechanism of pain that causes her to not get rid of the problem. Right? So very simple. Except the thing is that she got to a point where she couldn't understand what was causing her problem. And after having tried quite a few things, she accepted that she'd just carry on doing sports, as that's her passion also, but also deemed it important to stay fit. And as long as it's not too bad and she gets a reaction for a day or two, she would carry on this path. And I think that's what a lot of people seem to do and think. And of course, it makes sense, because if someone isn't able to help you to find out what the real cause is of your problem and help you with a solution to that problem, you're going to throw in the towel and say, okay, well, that's just how it is. My body doesn't seem to be able to deal or heal from the situation, and I'm going to, within the margins of being able to continue doing what I'm able to do, I'm going to do my sport, and I'm going to do my work, and I'm going to be social, whether it's social life, etc., etc. But I had to tell her and show her that the things that, now that we know what it is, the things that are actually reproducing the pain and the issue and the discomfort is really holding her back from real recovery. And so it was a difficult pill to swallow for her to be able to accept that she's going to have to stop certain sports and certain practices for some time to allow that low back instability to heal, in order for that nerve to stop being an issue. And it will also probably take some time for it to actually heal. It'll take a few months, because we want to make sure that actually the situation settles and she becomes more resilient, and eventually she'll be able to handle more load and pressure and strain from whatever sport you were doing. So it's an interesting case just to show that, you know, quite often I have this very frequently, that the the misdiagnosis quite often is the fact that someone has either got central sensitization, so they've got a sensitization process of either soft tissue or tissue in the spine, or they've got a nerve issue which gets triggered over and over and is misdiagnosed for a muscle or a muscle attachment or maybe a joint, where in fact it doesn't really have anything to do with those structures. And if it's treated for something that it isn't, quite often the wrong approach will lead someone to lose faith in the healing capacity that they have, when in fact somebody has a lot more healing capacity than what we often think. So I'm asking you to think about this case. Maybe you can relate to it, um, and maybe you can find some similarities. And if you have any questions about it, you're very welcome to send us an email. Have a look at our ebook. It also explains quite a lot about how you can avoid the triggers of everyday low back pain. And please visit our website, have a look over there. And I will be bringing you another case at some point in the near future. Keep doing the things that you love, and I say goodbye. Thank you.